What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Doing good. I'm really excited about the topic we're talking about today because it's a big part of our immune system.
Yeah.
And that is talking about the lymphatic system and how we can keep it healthy.
So break down a little bit about kind of what the lymphatic system is. I think a lot of people don't even realize that, this is a portion of your immune system, or we don't necessarily think about it when we're thinking of upping our immunity and things like that.
Yeah. Well, the lymphatic system is just like your venous arterial system is a bunch of little vessels all over the body that kind of are married to your capillary beds. And what they do is they promote the flow of lymph. There's really no pumping action to it to move the lymph around. Like there's not a heart like we have for our circulatory system, but it's actually moved along basically by exercise and movement.
Yeah, some contraction of the muscles.
Yeah, not only that, but it's also, with breathing appropriately. Like if you breathe through your diaphragm, that helps promote the flow of lymph. Other things like having normal bowel movements or having peristalsis, having your gut contract and relax also helps move lymph. But yeah, normal everyday walking, contraction of all muscles helps move lymph through the body. And it's very important because of what the lymph system does is it basically picks up cellular debris from the basically the capillaries, the blood system. The capillaries are kind of embedded with the lymph system, and there's little holes called fenestrations that this lymph can then flow into, or the particles from the blood can then get into the lymph system, and then from there it can be brought to what we call secondary lymphoid organs like lymph nodes and the spleen and what's called the MALT, which is the mucosa associated lymph tissue. The thymus gland is also part of that. The bone marrow is very connected to that because that's where a lot of our immune cells come from. And in the lymph system, cells like T cells and B cells basically do a lot of their work in the lymph system, or at least mature in that lymph system so they can go out into the body and help us fight infections.
Yeah, so it's a circulatory immune system.
Yep, it's a circulatory immune system, and it is very, very important to overall health. And so it kind of gets put on the back burner with all our other systems, but it's very important for immunity, have a proper functioning immune system. So it's I don't know, it's like the secondary lymph, what I call lymphoid organs are like the lymph nodes and the spleen and the mucosa associated lymph tissue. They basically do two functions. I mean, they basically help mature lymphocytes, hence the name lymphocyte comes from our immune cells that hang out mostly in the lymph. They're found in the lymph. These are B cells, T cells. Think about B cells, B standing for bone. They actually are kind of born in the bone marrow. T cells spend a lot of their life in the lymph system, in the lymph fluid, in these secondary lymphoid organs. So anyway, so lymphocyte maturation is one of the basic functions. And then the other basic function is lymph also promotes it basically traps antigens, foreign substances in the body, and basically exposes T cells and B cells to them so they can know what to go look for and to destroy. Mm-hmm. So something like viral particle or antigen, any type of antigen that's foreign to the body, it will get recognized via the lymph system. So that's it in a basic general understanding as far as the lymph system goes. There's so much more detail to that though, and we'll get into that. I think we're going to do a couple episodes on this, so we can get more into that in the other episodes.
Yeah. And so basically you have those lymph nodes at all the major areas of the body that you can think of, especially like the joints, like in the back of your knee. I know people commonly, like if you get, you have a sore throat, you kind of feel those lymph nodes on the side of your throat there. And just to talk about a lymph node palpation, what would be normal would be like a soft, non-tender, non-palpable lymph node. So really you shouldn't be able to palpate it if it's in a normal state generally. And then we know those abnormal, when we're feeling sick or we're not feeling well, or maybe something more sinister, we feel that the lymph node is tender, hard, and mobile. So it's kind of now become like a firm, I
Right.
guess, dollop there on
Yep.
somewhere.
Yep.
And they're located all throughout the body, these lymph nodes, like you kind of mentioned, Keoni.
Yep. They are. They're located throughout all throughout the whole body, but they are concentrated in certain areas, like you were saying.
Mm-hmm.
It's a lot of times that's why the doctor will palpate your neck and behind your ears and under your chin. They're looking for lymph nodes and they're looking for painful areas or anything swollen there. And a lot of times during infection, your lymph nodes will get swollen. And past infection, some lymph nodes become scarred or a little bit harder from past infections. So some people will be like, yeah, I've felt that lymph node. It's always been there forever. A lot of times in your inguinal area or growing area, you may feel one or two that have always been there that aren't so hidden, that are kind of hard and scarred, so to speak, from past infections.
Yeah. Those are definitely bigger ones, higher areas where more
Yeah,
stuff's passing
yeah,
through.
yeah. And then things that may be more sinister, you may or at least you want to rule it out. It's not always the case, where all of a sudden within a few days or whatever, people are getting big swollen lymph nodes. And they don't necessarily have a fever or anything like that. And that could be a sign, not necessarily means it is, but it could be a sign of like certain blood cancers and things like that.
Mm.
Yeah. So, but yeah, your lymph system is throughout, and it's in one of the main areas. It is in the mucosa associated lymph tissue, which is in the gut. This is where your body is looking at or at least being presented with foreign stuff, right? Every time you eat, that's foreign to the body, and it has to go through processing so that it can get into the bloodstream without your body thinking it's foreign and causing an immune reaction.
Right.
And so a lot of your lymph system is right there along the whole gut system where
Yeah.
you're digesting.
Super fascinating when we were cutting it up in a cadaver lab, Keoni, and you pull out this kind of like spider web system near the gut of this of the
Yeah.
the lymph, what you're talking about right there.
Yep. Yep.
And
Yeah, it's fascinating. One part of the lymph system that I find really fascinating is the thymus gland, which lies right behind your sternum, and it seems to have its most function when we're younger. It does its job, and then with time, as we mature, it seems to get smaller and smaller. But anyway, it helps develop the when we were talking about T and B cells. Think of B for bone. Think of T for thymus, and the thymus gland helps develop T cells, and it is a big part of us being able to distinguish between self and non-self. And that's huge, and that's what we need for an immune system. Is this foreign or not foreign? And
right.
things like cancer, trick the immune system into thinking that it's self instead of non-self. So, it's one of the things where we really want to have like a strong immune system, especially when we're going through treatment like chemo or radiation.
Yeah. Yeah, that's interesting like the way I understand the lymph nodes kind of swell up and become, like we discussed, where they're abnormal, the kind of tender, hard, and mobile. If you have what we were most taught as PT school is kind of lymphedema and that sort of thing. But as far as cancer goes, Keoni, so you would have a swollen lymph node and it has that kind of reaction, but it also is, the body isn't quite aware that this is, like we know cancer is kind of that constant continuing of cell growth, and the body's not necessarily able to shut that down. And so how we still see the swollen lymph node as well with that.
Yeah, you may see the swollen lymph node. It's interesting, and I'm no expert on it, but with certain blood cancers, like certain cells are basically aberrations, right? They're and hence the cancer. So they're not fully mature cells, and they tend to accumulate in lymph glands, or what you find is because of the certain type of cancer, that, you know, the infections are more rampant or whatever. And so then you'll see that as a result of the lymph node. You knock down your immune system because the bone marrow or the lymph system is not functioning appropriately, or making sure that you have mature immune cells. But yes, you can see that. And typically what we learned was, you know, if the lymph gland is like tender and movable, it's probably it's a good sign, as opposed to being very hard and immovable and not and may not even be tender, which may be more sinister type of thing, which could be cancer.
Right. So overall, the lymphatic system kind of deals with this lymphatic load and its ability to transport this stuff throughout the body and kind of clean up, like you were mentioning earlier.
Yeah.
So the lymphatic load being the amount of lymphatic fluid that you would be transporting, and then we can maybe see this build up in like things like lymphedema, where someone has like a swollen hand, for instance, or a swollen lower leg.
Yep.
This is obviously super late stage, or different than just getting cancer or having a swollen lymph node because you were exposed to a virus or anything like that. This is much more serious.
The number one cause of like lymphedema, where you get an accumulation of lymph. Lymphedema is basically where you get lymph no longer in the vessels. It's now in the interstitial space, right?
Yeah.
So it's in the tissues, and basically, you know,
that transport capacity has overrun the load.
Right.
Or decreased to the point where it can't deal with the load.
That's right. And that load may come from like increased blood pressure, right? Having blood pressure too much. It may come from a blockage in the lymph system, right? So let's say a lymph node is scarred, or you've had surgery in a certain place that cut that channel, so to speak, the lymph vessel, and scar tissue no longer lets it flow, and now, or appropriately, and so now it accumulates and you get backup. So I see this a lot with in cancer, where people have some lymph nodes removed. Like one of the side effects are going to be, not always, but one of the side effects could be lymphedema. So the accumulation of fluid from this backup system. Another cause would be where the osmotic pressure of the fluid in the vessels, especially in the capillary beds, is not in balance, right? So proteins in the blood help balance that out. If you are protein deficient in your blood, and usually people are very sick when they have this, you'll see you'll see fluid leak out of the vessels, and even in the lymph, because they can't hold it into the vessels, into the interstitial fluid. So there's a number of reasons that can cause lymphedema, but the most common I've seen was usually surgical things, from cancer or other surgeries, where the lymph system was like cut or blocked or scarred over, where it can't flow appropriately. Is that basically what you've seen?
Yeah, and basically all these are, as far as the breakdown, primary versus secondary. Everything we're discussing here would be like a secondary lymphedema, where something caused this to happen, as opposed to just being kind of hereditary or congenital, which I haven't seen. I've definitely seen.
And I have seen some cases of that also. So, you know, it's just finding what is the cause with that.
So as far as the treatment goes, Keoni, for like a physical therapist, we do what's called complete decongestive therapy. And there's some physical therapists who are certified in lymph, and this is like what they manage. So they really manage this really well, and they're experts in it. Definitely not where I'm at right now.
So what does that mean? What does that entail actually? Is it massage? Is it tissue work?
Yeah, so it's a little bit of all that. So it's 3 components, or it consists of a few components for it to be technically complete decongestive therapy. So with that, you'll have a restoration of the skin, and so some skin care, because we know this area is not getting as good of fluid to the area, whether that be in or out, period. It's just not being taken care of as well if we think about the skin integrity. We often see like skin breakdown and that sort of thing, because this isn't getting good blood flow, or it's getting that venous pooling or something like that.
You're right. Okay.
And then with that, you'll do manual lymphatic drainage, which can can include exercise, or like you're talking about, where you're literally kind of doing a massage to that tissue to kind of work the lymph up and out. Then it can be followed up with some type of compression garment. And that's where I would really encourage you to find an expert if you are dealing with this, or someone who really knows how to appropriately dose and deal with how much of this compression you should be getting and what level and how you should apply it. Because you shouldn't just stick a compression garment on. You're going to kind of overload that transport capacity if you were to do that. And it could have a worse outcome than getting this full kind of decongestive therapy that we're kind of talking about. And then
Yeah.
some decongestive exercises. So the important thing to know with decongestive exercises is you're going to clear the proximal portions first. So let's say my right arm is having lymphedema and I've got a swollen right arm. That means I'm going to clear my neck lymph nodes in that region and move down distally. So I'm going proximal to distal from my neck all the way down to my fingertips, and then work back up to actually clear the lymph. So the reason you're doing that is so you clear out basically the highway before you add more cars to it.
Oh, that's interesting. Okay.
So that's one of the things that's super important to know, because if you just start distally, at your fingertips and start pushing all that up, you haven't necessarily cleared, you have a I-5 in California where you haven't cleared the traffic before more traffic is coming.
Yeah. Oh, that's very interesting. So you're basically going into oncoming traffic first to clear it, and then going with the flow of the lymph system
Right.
later on.
Yeah. So clearing those proximal portions first.
Okay.
And then moving more distally, and then you're going to kind of work back up. And the easy way to think about it is that all exercise is going to help, kind of like we mentioned with walking, that sort of thing. But if you add all ranges of motion, so again, we're starting proximal, working distal. So we're going from the neck all the way down to the fingertips and then working our way back up. And if we add against gravity to that, so let's say we're laying down, and we hold our arm up, that's going to even just have a greater effect because we're going to use gravity to assist us in the process.
Right. Yeah, and this is something that some people don't realize. I got some of my patients with lymphedema in the extremities, especially the legs, is, if you're relaxing, try to elevate them. That helps.
Right.
Yeah,
Use what we have.
Right.
And then that manual lymphatic drainage is like it sounds, manual lymphatic drainage. So this is where you will get kind of that light effleurage, like massage, that light pressure to move the lymph along. And again, same guidelines go, where you're going to work from the proximal portion because you're going to clear the highway before you add more cars, and then work your way back up distally. So again, the fluid in the involved extremities cleared first, and the proximal portion, then you work distally from the limb back up.
Okay. And it seems like some of this people can do on their own, depending on the area they're working on, right?
Yeah, absolutely. And especially once, again, like Keoni mentioned, neither of us are experts in it. But if you get someone who can really educate you on it, and then they get you on, like I know when I took my lymphatics class and we had these expert PTs kind of teach us, they're seeing a patient once a week and you give you specific guidelines on how to manage it and some things to watch for. And you can very easily monitor, how your gloves are fitting or your socks, shoes, that sort of thing. And that's how a PT would most likely monitor it, other than, some volumetric measurement or like a girth measurement. So it's very easy to manage. And I shouldn't say easy, but we're all very capable of being aware of it once we're educated on it to manage it.
Yeah. Yeah, it can be really concerning for a lot of people, but there's a lot of stuff that you can do on your own to help manage it.
Just being educated, like the garment compression therapy, you don't want to do, like I mentioned in the complete decongestive therapy, kind of that last stage would be this compression therapy, or you possibly do the compression with exercise, give that little added compression and benefit to it. And obviously you want to make sure your compression isn't too high to where you're hurting the arterial flow to begin with. So you have to just be educated on this, and I'll just spat off a few numbers just so we have them. So 20 to 30, this is milligrams of mercury of pressure, would be used for like the upper extremity. So the lower extremity is obviously going to need a little bit more, 30 to 40 or 40 to 50. But again, we want to be really careful. Like we wouldn't want to use 40 or 50 on the upper extremity, because we're going to kind of occlude where we're trying to get blood flow to, which is already a little bit of part of the problem.
Yeah.
So just a little bit there on garment compression therapy. But again, I'd seek an expert.
Yeah. And there are different types of garments. I mean, I know some people, especially in the lower extremity, you have these compression stockings, which are a little bit difficult to put on and take off. Whereas opposed some people just seem to be a lot better just do like a compression sock instead of a whole stocking that like covers the whole leg, you know,
Yeah.
and any of that helps if you
And
can
it
do
needs to
one
be
or the
fit
other.
to you, you know, taking
Yeah,
one off the, if you're in the very late stages of lymphedema, taking one off the shelf is not going to work for you. It's probably going to be too high of pressure, or
right.
the other way if you're, you know, just in the beginning stages of this. So really finding a medical made garment as opposed to going to CVS and, you know, managing it that way.
Right. So any exercise works though, right? For the most part.
Yes. Yeah. Any exercise works. Do it against gravity, and just, you know that you're wanting to clear the highway before you add more traffic. So if it's your arm, starting at the neck, working your way down to the arm, or vice versa. But absolutely, any exercise helps. You know, if we're talking about the leg again, we're doing something in the abdomen and breathing, like you mentioned, Keoni,
Mm-hmm.
before we start actually doing like hip circumduction. And so circumduction just being going in circles with the limb. So thinking about, you're doing all types of ranges of motion to help clear that lymph, that buildup of the fluid there. So everything, like if you're talking about your wrist, you're doing flexion, extension, all types of the motions that you can do at your wrist to really get everything moving fully.
Okay. Anything else we should hit on with that?
That's it on me, Keone. I know that on the next one, we'll talk a little bit more about kind of some herbs that can help us.
Yeah, there are definitely some herbals, and we can talk about other naturopathic things that we do. I mean, we hit on quite a few. I mean, this is where the conventional and the unconventional treatments, they tend to be the same. Using your muscles to pump the fluid, the lymph,
Yeah.
right? Using manual therapy, using massage to make sure you're moving lymph, compression stockings, all that stuff comes into play. And then we can go into herbs that, you know, seem to help with the immune system, seem to help keep you healthy. I mean, there are certain things out there, and we'll talk about this later, that they'll talk about like taking herbals as their lymph movers. You know, that's not necessarily true. You're not going to be able to take an herbal substance and move lymph.
Yeah.
But what you can do is take an herbal substance that uh, helps the overall immune system or lymph system
Yeah.
function better.
Yeah.
So
So overall,
we'll talk about that later. But people really, there are so many ways to move lymph that don't include exercise, and that is like breathing appropriately, by making sure you have an appropriate digestive function. You know,
yeah,
making sure
against
you're
gravity,
again,
elevating
yeah,
your limb.
yep, exactly. Like getting used to making sure that fluid doesn't accumulate in the lower limbs or in the upper limbs, and or when you lay down, that you can help promote that flow.
Yeah. Awesome. All right. Well, thank you for listening, everybody. We'll talk with you next week.
Yep. Thank you, everybody.